Hi, Kevin Henry, the Group Editorial Director for Advanstar and Modern Hygienist, and I'm on a Google Hangout this morning with my friend and America's dental hygienist, Anastasia Turchetta. Good morning, Anastasia.
Good morning, Kevin.
How are you this morning?
I'm a little cold, but other than that, it's a great day here in Pennsylvania.
Into spring, so hopefully I will warm up real soon, or at the
Exactly.
beginning of spring. Anyway, so today we're going to talk a little bit about the craze known as oil pulling, and it seems like I can't go anywhere online without seeing an ad for it along the side of my computer or hearing about it on CNN or who knows where else. And I know you've done some research on what oil pulling actually is, and I'd love for you to share that with our audience this morning.
Well, you're absolutely right. I have had so many questions probably in the last 2 months about oil pulling, and I thought, what is this? And it's actually organic coconut oil, or you can substitute it with, sunflower oil. And what you do with it is you just take a teaspoon to a tablespoon, your choice, and you swish it in your mouth for 20 minutes. And it's supposed to basically create this matrix where it pulls the bacteria, the toxins, the funguses, whatever else is going on inside of your mouth, and then you're supposed to spit it into a trash can, because the thicker that it gets, it would clog up your sink. It would be kind of like how bacon grease, you're not supposed to throw that into the drain. And I found it interesting because I'm like, where's the research on this? Because we're evidence-based. I just wanted to know, okay, who has done it successfully? Has there been a study group? Because there's people saying it whitens your teeth, it gives you health benefits, you would be amazed at all this wonderful stuff it does. And I'm thinking, well, if I could have a patient do that, that's great, but show me the evidence. And I'm not seeing it. There's nothing out there.
And this is not a short procedure either, right?
No, they recommend it to be done, like if you're starting, a lot of articles have stated that, start out for 5 minutes, up it to 10, and they recommend you do it in the morning. But here's the thing, am I going to do it? No, I am not going to do this, for the record, because I've had some people say, well, are you going to try it? No. I like to try our products for taste and texture. You will not see me swishing with that. That's just, no, it's not going to happen. Yet, I really have trouble seeing our patients and professionals doing this for 20 minutes in the morning and adding that onto the routine. I mean, Kevin, I would rather do something cardio and do something for my body and physical health and soul than switch with coconut oil. That's just my take on it.
Well, sure. And like you and I were saying before we went on the air, that we're having trouble getting people to floss for a very limited amount of time. Yet this is 20 minutes. It's crazy.
That's a long time. I mean, so if you look at that and say, okay, it's 20 minutes, then till you take the time, you spit it out, and then you're supposed to brush your teeth, and then of course, you rinse with warm water, then you'll brush your teeth, and then you floss. I'm thinking an estimated time in the morning is about 25 minutes versus our patients to brush for 2 minutes. Floss might take a minute or water pick, and then maybe rinse with a mouth rinse. So maybe a total of 3 to 5 minutes. It's kind of a no-brainer, and I think the benefits and the evidence are definitely there.
Well, let's talk about the benefits of it, because I know that obviously, like you said earlier, the whitening's the huge aspect of it, but there are some other aspects of the whole oral health thing that you found that it doesn't do anything to it all, right?
Right, and I mean, there are some people, like you said, I mean, they can claim for whitening, but if you go back to it, do our patients really know if they're a candidate for whitening? I mean, I get wanting to have that nice white smile, and I understand it, but the point is what else is going on? I mean, do you have composites? Do you have crowns? I mean, are you a candidate for whitening? The other thing, they're saying it benefits your health, yet they don't address periodontal disease, gingivitis, caries or cavities. They don't address that, and I think that's the conversation that needs to be started chairside for us with our patients.
Well, and that was actually my next question, is what do these dental professionals that are watching this need to talk about with their patients regarding oil pulling?
I think we have to start it out. It's like anything else in the news. So either put it in your newsletter, put it on your Facebook fan page, and get the conversation going. Hey, have you heard about oil pulling? We do know there is no evidence stating it helps with periodontal disease or gingivitis, and this is what's going on in your current state of oral health. I think that's where it begins.
Very cool. Any other piece of advice or anything else you'd want to share about it before we sign off today?
It's the 3,000-year-old kind of a concept, but I'm thinking, I just don't see us sharing this to do with our patients because there's no evidence again. And you know, if I think the whole point is to get our patients to a healthy state in their mouth, and this is just not a way to get them to do that. So really, back to the basics is the best way to go.
Anastasia, as always, I appreciate your time and expertise. Thanks so much.
Thanks for having me, Kevin.